I think that dental implants are a tremendous financial investment, and it's not inexpensive. And I always tell patients, I'm like, listen, it isn't cheap. If it were free, this is what we would be doing. We would take out a tooth, we'd put an implant in, and we'd graft, and those are the types of things that we need to do. But I think that if we work hard and we have a lot of experience over the last, for me, the last 19 years, getting experience and doing a lot of training, that we can use that expertise and leverage that to give people a wonderful result. And we know that if we try to do this correctly the first time, that we can perhaps get these implants, even though they're not guaranteed to last a lifetime, maybe we can get 10, 20, 30 years out of them. And in our practice, we've been placing implants since the 90s, and we've got many thousands of patients out there over the course of our 4, 5, 6 doctors we've had kind of move through. So we know it's a tremendous financial investment. We take it very seriously, and we try to do the very best work that we can do. And we, like I say, we leverage our experience and our education to make sure that that happens. I think that the education I've pursued over the years has honestly made a tremendous difference in what I can provide to our patients here. I think that oral surgeons in general have great training. I know I trained at the University of Michigan. I think grateful for my mentors and for my teachers that they were able to teach me what they could. But it's a finite amount of time, and so we have to go and continue to learn on our own. So doing education and pursuing things that actually maybe we didn't anticipate would be a need. So these types of grafts, when we train to do bone grafting in the hospital, well, we have a hospital available, so we can go to the operating room more easily. We can take bone from different areas of the body and we can put that in. But when you get out in private practice here, you start to realize that patients can't necessarily go into the hospital. They can't go through such a large surgery. And so we started to pursue education whereby we could go to courses, learn about new materials, learn about new techniques that we can employ in order to help patients kind of go around some of the more complex traditional ways of doing grafting. And so the education to me has been fantastic. Like I said, there's mentors from around the world who are doing things so well, and to be able to access them and to learn from them so that we can place grafts in patients without them having to go to the operating room has been a tremendous improvement. It's funny, the improvement in the quality of life from a dental implant. I can relate. I recently saw my mom, and we need to take out her anterior teeth on the top. And so she had some veneers, and those became carious. They had cavities on them that started to break down. And so we had to take out those teeth. And you can see, like, from a standpoint of, hey, this is my mom, and when you see somebody smile, you see the dignity that they have, and you see the improvement and what they've lost, that sense of identity that they've had before, where they, I know with my mom, obviously all my life, and to see her smile, she had a beautiful smile, and then to lose that and to restore that dignity and that smile. And then there are other teeth in the posterior where now we're able to take those teeth out and put in implants, and now she's chewing again. And so we see that, I do the same thing. I always tell my patients is like, I did this to my mom, I've done this to my aunt and my father-in-law, and I feel like these are really important things that we can do to restore one's dignity as they smile, allow them to go out to dinner, to have meals, and be able to chew their food. They're obviously going to be more healthy if they can chew. And so it's super rewarding. I can see that from my own family, and I consider my patients to be an extension of them. I think implants can fail at times. And so what do we do is going to be, it starts with the education that we receive. And there are some indicators that we can follow that will determine whether an implant is going to be successful. Do we have enough bone? Well, that's the reason we do the bone grafting. Do we have enough gum tissue that acts as an insulator in order to help seal up the area? Well, that's why we do our soft tissue grafting and soft tissue training, in order to make sure that everything's going to turn out the way that we want it to. It's easy to place the implant. We can place the implant and have people kind of heal up and they leave, but we want to know what's going to happen years from then. Really, success is going to be judged what happens years. We can get an implant to heal because the body is so terrific at doing that. We can make things look good temporarily, but if we really engineer the area and we have enough bone and we have enough soft tissue, then that's going to make all the difference in terms of longevity. And so that's where, when we go back to our education and we go back to our experiences over the years, we can learn from all of that. And in our practice, which started in 1992, I have had the benefit of having mentors that have been present from that time. So when we look back at, okay, this is what we've been doing over the last 30 years, how have our patients responded to these different types of treatments that we've employed? And we're able to kind of determine, hey, this works, this doesn't work, and we can use all of our collective experience over, decades in order to try to improve and move forward and do the best that we possibly can. Yeah. So I'm sensitive to failure, that failures happen, know that they're going to happen, but at the same time, I think if we leverage our education and our experience, we can help lessen the chance of that occurring.